Tracy, thank you so much for being here today to talk about the Diabetes Prevention App program that will be piloted in Alberta. So when does the pilot for the program start?
We started recruiting patients back in February of this year. And so the project is underway and we'll be recruiting and following patients for the next year.
So what does it mean for the pilot to be done in Alberta?
Well, what we'd like to do is what we've partnered with Alberta Blue Cross and our primary care networks and physicians to test a mobile app within Alberta that allows us to identify patients who are pre-diabetic but at risk for diabetes and put them on this prevention program that helps them with healthy eating, exercise, and general coaching to support their lifestyle changes. So we believe that the app will have an impact for Albertans, but in keeping with trying to make sure that it does work, we're doing a one-year pilot to test the application, recruit a significant number of patients, and then follow them out for a full year to see if the lifestyle changes work, and if they do, how, what are the results that we saw, and then from a sustainability, do the individuals that use the app and the health coaches, does it improve their quality of life? Do they have weight loss? Have they increased their exercise? Are they making better choices around healthy foods, etc.?
So how can someone join to be part of the pilot program, or are those people already selected?
No, people can join. We have been working with the primary care networks across Alberta. Our selection criteria is to choose those patients through their family doctors who have a high A1C or their blood sugar levels are higher than normal, and that they aren't currently diagnosed as a diabetic. If they are willing and interested, their family doc can refer them, and then we would register and enroll them in the program.
So how will the app help to prevent type 2 diabetes?
Well, in the work that we have done, when we were working with a company that has a proven product. It was approved by the CDC, and the reason that they have had success is the app is very, you don't have to call somebody. You get immediate feedback from the health coaches on the app. You can get your questions answered in real time. So people who are really interested in, let's say, wanting to make sure that the food that they have chosen for dinner, they can take a picture of their meal and the app will give them feedback on, that's a good selection of protein, or you might have a little bit too much carb. But it gives people that just-in-time feedback. They can put in their exercise and their weight, and the coaches can actually help answer questions and just support that lifestyle change without having to book an appointment with a nutritionist, a family doctor, or a pharmacist or somebody else, because the app is, on your phone and you can use it, 24/7.
How long will the pilot process last?
Well, the pilot started in January, and we will be and we started recruiting people last February, so just this early February. So the pilot will actually go until next year. And our goal is to get about 500 Albertans on the app and then follow them longitudinally for a full year.
Thank you again so much for joining us today.
You bet.